Hello, everyone. Good evening. So, hi, everyone. Join the session quickly. We are going to do the Inset PYQs quiz discussion, and today I'm live side by side, both on YouTube and Instagram, because everybody wants to see this quiz. Some are on Instagram and some are on YouTube, so I thought that we can find out some way. Hello, everyone. Good evening. Welcome to the session. Hello, sir. So I have made some. Hi, Lokesh. When are you taking class for FMG? June. Very soon. Very soon I will come up with the PYQs for FMG also. And I know you people are waiting, but really thoda sa busy ja raha tha. And now I'm coming back on the track, and I'm trying to balance out both the sessions on the NEET PG as well as the FMG. So very soon I will be taking the class for the FMG students also. Don't worry. Hello, everyone. Yes. So nothing 0.4153. So this is actually going live on both YouTube and Instagram. And but on Instagram also you can replay it afterwards, until and unless we deleting it. So all the sessions which were there on the Instagram were also available for replay. नीट पीजी का रिवीजन करा दो. नीट पीजी का रिवीजन बेसिकली वी आर ट्राइंग टू फिनिश अप विद द इनिसेट पीवाईक्यूज, एंड उसके बाद वी विल बी टेकिंग फॉर द FMGs, and we will be taking for the NEET PG also. So 3 sessions होंगे. Don't worry about it. NEET PG के लिए, INSET के लिए and FMG के लिए मतलब we will be focusing on the topics which are most frequently asked here, and here. So I think now you don't have the problem. Best retinopathy of diabetes mellitus 2 and hypertension and ST. Best retinopathy of diabetes 2. I could not get your question. Hi, Sonal. Question क्या है? I could not get your question, Bipin. So, let's get started without further wasting much time. So, we are going to start with this yesterday's quiz. We are going to start with the yesterday's quiz. And nowadays, some people were asking me what is the schedule of the quiz. So nowadays, we are going with the inicet PYQs quiz. Okay, once we are finished with the inicet, then I will plan accordingly. Either we will go with the NEET PG, FMG, and if you want, then we can resume the topic wise quiz also. So definitely I will be talking to you people. I will take the poll, and whatever goes with the majority, we will be taking something like that. ठीक है ना. तो हम PYQs कर रहे हैं इनसेट के, तो ऑब्वियसली दैट इज गोइंग टू रिवाइज द इनसेट, है ना. मोर ओवर पूरा इनसेट ही रिवाइज हो जाता है बाय द PYQs. सो लेट्स गेट स्टार्टेड. So question number 10 से I am starting. Question number 10 से what are the yes. So they are asking you chemotherapy for the retinoblastoma. तो simple question है, direct question है. What is the chemotherapy for the retinoblastoma. Chemotherapy for the retinoblastoma, who will give me the answer? It is the VEC regimen hai. V for vincristine, then we have E for etoposide, and what is C? C सबसे ज़्यादा important है. Whenever they are asking the question, they are always asking you C. C is not cisplatin. पता नहीं why. I have seen that most of the students go with cisplatin most frequently. तो cisplatin नहीं है. Exactly, it is carboplatin. तो प्लीज रिमेंबर दिस फैक्ट, बहुत बहुत इंपॉर्टेंट है. इट इज विनक्रिस्टीन, इट इज इटोपोसाइड, एंड इट इज कार्बोप्लेटिन. And if you want na, you can maintain one small diary or spiral, या if you have 20th notebook, if you have already made the 20th notebook, तो उसमें भी you can keep on noting down these important points जो कि हम इनसेट PYQs का डिस्कस कर रहे हैं. You can make a small diary. हाँ, तो यू कैन मेक अ स्मॉल डायरी फॉर द इनसेट PYQs, एंड ये सारी चीजें यू कैन कीप ऑन नोटिंग डाउन दिस. यस, वन शॉट रिविजन बहुत जल्दी होने वाला है, एंड इन दैट वन शॉट रिविजन वी आर गोइंग टू कवर ऑल द इम्पोर्टेंट हाई यील्ड पॉइंट्स, सो डोंट वरी अबाउट दैट. उसके साथ हम लोग आने वाले हैं, or like the last year, we are preparing for it in such a way that we are giving you all the important topics in the most concise and high yield manner. ठीक है ना? So don't worry about this. Chemotherapy हो गया. Now listen to question number 2. Question number 2 देखो, which parameter is decreased in retinitis pigmentosa? Who will answer this? Which parameter will be decreased in retinitis pigmentosa? RP के patients में which parameter will be decreased? Who will give the answer? Options क्या है? Arachidonic acid, thromboxane है, trialonic acid, या फिर docosahexaenoic acid. So yes, it is the docosahexaenoic acid. ये again एक direct question है, और this has been asked in the AIMS and the inicet many times. ठीक है? So direct question है docosahexaenoic acid. This is also the question which has been asked many times, that it gets decreased. Pardon me because I keep on looking here and here because constantly दो sessions चल रहे हैं, तो I am looking at both. So I hope you don't mind that. ठीक है? तो both are actually decreased in the patients of the रेटिनाइटिस पिगमेंटोसा. अब इसमें क्या है कि जब हम आरपी की बात कर रहे हैं, दैट मीन्स होल ऑफ द टॉपिक इज इंपॉर्टेंट. डोंट थिंक कि खाली ये पैरामीटर दे कैन आस्क एनीथिंग. दे कैन आस्क यू फ्रॉम आरपी. सो यू शुड नो द ट्राइड ऑफ आरपी है, इनहेरिटेंस पैटर्न है, मोस्ट कॉमन स्पोरेडिक, फॉलोड बाय ऑटोसोमल रिसेसिव, followed by the autosomal dominant, followed by X-linked recessive. Then उसके बाद we are having what you called as today's quiz. Today's quiz, I think, is not taking place because we are going to have the discussion. So don't worry. It can take place tomorrow because I had to take the discussions for all these things. तो I think आज नहीं हो रहा है. Let me see. So they are trying to take the quiz. ठीक है? Okay, so I was telling you that if the RP is important, retinitis pigmentosa important है, then means you have to read everything. ठीक है ना? Everything on RP. RP का inheritance pattern है, night blindness हो गया, clinical features हो गए, everything about that RP is important. Moreover, I also give you the systemic associations of retinitis pigmentosa है ना, all the syndromes which are actually associated with the retinitis pigmentosa, they are also important. तो you have to remember everything about RP. तो इसमें क्या है, you have to filter out the topics. If I am talking about that they have given you one question on RP, then you have to understand that the topic of RP is important. Keep on noting down those topics and do the multiple revision of that very topic, so that when they give any other question also related to the same topic, then also you are able to answer. Okay, that is the best way of preparing from your pyqs, best way of preparing from the pyqs. Okay, चलो नंबर थर्ड पे आते हैं. दिस क्वेश्चन इज ऑन टोसिस. दिस क्वेश्चन इज ऑन टोसिस है, where the child is coming with the drooping of the upper eyelid. अब क्योंकि drooping of the upper eyelid है, इसका मतलब there is a ptosis. Now how much ptosis it is है ना, you have to find out whether it is mild, whether it is moderate, or whether it is severe. mild है, moderate है या severe है. They are saying कि जो palpebral aperture है, palpebral aperture is 6 mm. Now if they are saying palpebral aperture 6 mm, how to find out the amount of ptosis? You have to understand this. The normal palpebral aperture, how much it is? It is actually 10 to 12 mm. Always remember कि जो normal palpebral aperture है वो 10 to 12 mm है. So if they are saying कि palpebral aperture is 6 mm, that means we are having a ptosis which is 4 to 6 mm. If we are having a ptosis of if we are having a ptosis of 4 to 6 mm, that means we are having a ptosis which is severe. And severe के लिए we do the frontalis sling operation. That is why the answer to this question is frontalis sling operation. So guys, it's a request. All those people are watching the YouTube live, Insta live. Please subscribe to the channel. Please like and please share the video. That is a humble request to all of you. If everybody and each of you can share this video to at least one place, then we can help the other students also who are actually preparing for the same examinations. Now, another important question, the drug used in acute congestive glaucoma. The drug which is used in acute congestive glaucoma. So they are saying, is it pilocarpine, is it acetazolamide, or it is both? Pilocarpine है, acetazolamide है. So if I discuss the treatment of the acute congestive glaucoma, if you discuss the treatment, है ना, what is the first drug to be used? First drug is your acetazolamide, second is the mannitol, and then drug of choice है. The drug of choice is actually pilocarpine. So any of these drugs, if they are giving, then we can use all those drugs. First drug to be used is acetazolamide, second is the mannitol, and drug of choice is pilocarpine. ठीक है. नेक्स्ट क्वेश्चन है, which anti-glaucoma drug causes apnea in infants? Who will answer this? बहुत important है, and I always emphasize on this question in the classes also when I taught about the anti-glaucoma drugs है. Which of the anti-glaucoma drug will cause ocular hypotension है, hypotension with the apnea? Now these are actually the features of CNS depression, because these are the features of CNS depression. So which drug is a neuroprotective which will cause the CNS depression? So I can see a series of right answers on both the sides. It is the brimonidine. Exactly. Answer is brimonidine, neuroprotective drug hai. Most common ocular manifestation of myasthenia gravis, ये बताओ. This is actually the ocular association of the systemic diseases, and I have given you the table, the flow charts in the classes, and you have that ocular associations of the systemic diseases, hematological disorders, infectious disorders, hematological disorders, everything you have, है ना? So myasthenia gravis is one topic that you are studying in the medicine. Myasthenia gravis में क्या है? It's a autoimmune disease where we are having the antibodies against the acetylcholine receptors. If you are having the antibodies against acetylcholine receptors, then what will happen? It's a disease of neuromuscular junction. Because it's a disease of neuromuscular junction, so pupils are normal here, and basically the skeletal muscles are involved, and skeletal muscles are your extraocular muscles. Extraocular muscles are your 7 pair. We have LPS muscle, 4 rectus, and the 2 obliques. Now LPS muscle is a skeletal muscle, and therefore due to this LPS muscle we will have the drooping of the upper eyelid, and due to the drooping of upper eyelid we have ptosis. Very important. most common ocular manifestation in the patients of the myasthenia gravis is the ptosis. ठीक है, चलो दूसरा वाला बताओ. दिस इज अगेन वेरी इजी. मोस्ट कॉमन कॉज ऑफ प्रोप्टोसिस इन एडल्ट्स. हु विल टेल दिस? लेट्स सी कि इंस्टा फॉलोअर्स पहले बताते हैं या यूट्यूब फॉलोअर्स पहले बताते हैं. व्हाट इज द मोस्ट कॉमन कॉज ऑफ प्रोप्टोसिस इन एडल्ट्स? So let's see who will answer first. Yeah. So I can see the right answers on both the sides. We are having the thyroid ophthalmopathy. It is the thyroid eye disease. Thyroid eye disease की other important things. It's more common in females. Middle age है. With the smoking history है. If I talk about hyperthyroidism, ठीक है ना? तो it's inappropriate to say only hyperthyroidism, because जो thyroid eye disease होती है, that can occur in hyper also, in hypo as well as euthyroidism. Hyperthyroidism में क्या होता है? 90% of the cases are hyperthyroid, लेकिन 6% of the people can be euthyroid and 4% of the people can be hypothyroid also. So it's a great, blunder that we think that if the patient is not having hyperthyroidism, then it will not be a case of thyroid eye disease. It can occur in all the three. Another important thing is that the first sign of the thyroid eye disease. Now, though thyroid eye disease is the most common cause of the proptosis in adults, the first sign of the thyroid eye disease that you get is not proptosis. The first sign of the thyroid eye disease is not proptosis. It is actually the upper lid retraction. Upper lid retraction. That So you are getting the deltrim sign, the upper lid retraction. That is the earliest sign, and that will be followed by proptosis. Then another important thing is the order of the muscles involvement. Order of muscle involvement के लिए we have I, M, slow. I for inferior rectus, M for medial rectus, S for superior rectus, L for lateral rectus, and O for obliques. उसके बाद very very important है ophtha with radio. You will get the sparing of tendons. मतलब this is a very very characteristic feature है, बहुत सारे questions में मिलेगा. The sparing of tendon effect. The origin and insertion are not involved, are not affected in cases of thyroid eye disease. So whenever we have thyroid eye disease, you will get sparing of the tendons, which will give you typical Coca-Cola bottle sign. Coca-Cola bottle sign मिलने वाला है in cases of thyroid eye disease. All the important things है. Then next, which one of the following procedure involves the glaucoma drainage devices? ये कौन बताएगा? Which of the following will involve glaucoma drainage devices? When we are giving the glaucoma drainage devices, then what is the name of that surgery? Quickly, fastest finger first पे जाते हैं. Glaucoma drainage devices की surgery का name. So yes, correct answers. It is called as sit-on surgery. No Saban, it is the sit-on surgery. Trabeculectomy होती है. First we do the trabeculectomy, and if there is a failure of this trabeculectomy because there is a fibrosis of that bleb, there is a healing of that bleb, then we can give the glaucoma drainage devices to maintain the patency of that bleb. This surgery is called as sit-on surgery. We can have glaucoma drainage devices which are made up of latex, like we have Ahmed glaucoma valve, and also made up of stainless steel. The ones which are made up of stainless steels, are called as the mini express glaucoma shunt. So this was about your sit-on surgeries. Now we have esotropia. Esotropia is commonly seen in which type of refractive error? So whenever we are talking about the non-paralytic kind of squint, whenever we are talking about the non-paralytic squint, it can occur due to the refractive errors. It can be eso, it can be exo. So when we have the myopia, these people have a problem in looking at the far objects. So we will have more chances of divergent squint. While in hypermetropias, we will have more problem in the near vision. That is why we have more chances of convergent squint, that is your esotropia. So this is another important concept. whenever we have got a squint, which is a non-paralytic variety, then it can occur due to the refractive errors. So another important question. This goes with your yesterday's quiz of inicet pyqs. I hope you have understood. I hope you have understood this one. Acha, one more thing, guys. For all the students who are watching this, and if you are really, really serious about your inset preparation, especially, then do watch the video on ophthalmology instruments, because you know inset people are very, very fond of asking this. So though we are covering in the classes also, but still, if you want to revise all the instruments at one place along with the images, then you can utilize the PDF that is there in my Telegram group. You will find it, and your ophthalmology instrument video is there on the YouTube. You can go through it, and I can assure you that it's going to help you. If you are a third year student, and if you are preparing for your exam as well as ward living, then that is a boon for you. All the instruments, especially the cataract surgery instruments, which are mostly asked from you people, are also present there. Are also present there. So this was a discussion on the quiz. You can see now. Let's discuss some of the questions that guys have asked me. So some people have asked me that is the 2 months time enough for the preparation. So guys, I would say that this is a very subjective thing. So for some people even 6 months are less, and for some people even 2 months are more than enough. So it depends upon what kind of determination you people are having. If you have decided that you will do and you are committed, है ना, commitment भी जरूरी है, खाली decide नहीं करना है. You have to be committed and you have taken the decision, then no one can stop you, and 2 months maybe you can do wonders. I have seen people who were not actually preparing to give the exams, and somehow the exam got postponed for 2 months, and they tried their best in those 2 months, and they did come with the good rank. So obviously time is required, but quantity of time is less required than the quality of time. Quality of time, if you are spending it wisely, will definitely help you. Then there is a question. There was also a question on the preparation of 20th notebook. So how to prepare a 20th notebook. So guys, I keep on telling you to make the 20th notebook, how much important it is, how to make the 20th notebook. So see, there is one notebook which you are going to see more often than not in the last 2 weeks. And if you talk about the practicality and feasibility, you will not be able to open every notebook, you will not be able to open every GT, you will not be able to open every Q bank, every test. ठीक है, तो इसलिए there should be one book which you know consists of your volatiles, the difficult things, images, which you need to see, and you have to see in the last 15 days. So pehle to you have to understand what is the concept of 20th notebook. So for every person 20th notebook will be different. It will not be same, है ना, more or less same हो सकता है, but obviously everyone's volatiles are different, difficult questions are different, different topics as well as different subjects. So you have to make a separate notebook which is separate to the 19 subjects notebook. That's why it is called as the 20th notebook. And you are going to add everything from each and every subject which is difficult for you, which is high yield, and which you should revise in the last 15 days. So how to control anxiety? देखो anxiety होगा. I won't say कि anxiety is unnatural. Anxiety is natural because we are humans and we feel apprehensive because we have to prepare. It is a period of struggle and stress. अगर अब भी नहीं होगा stress तो कब होगा, है ना? तो स्ट्रेस होगा, stakes are very high, paper is very important and it's a matter of your life, your career, but we can control anxiety by doing our best. Anxiety कब होती है? When we know that we are not able to do our best. हम कर सकते थे बट हम नहीं कर रहे, है ना, हम कर सकते हैं बट हम नहीं कर पा रहे हैं, then you feel anxiety. But if you have the satisfaction कि मैं जितना कर सकता था, मैं जितना कर सकती थी, I have tried my best, I have given my best, so that will definitely relieve your anxiety. ठीक है, काउंसलिंग सेशंस बहुत सारे चल रहे हैं, you can take them, लेकिन you know, above all the sessions, it is you who can control yourself. मुझे कोई कितना भी समझाता रहेगा, but if I am not able to control myself, then nobody in the world can control me. ठीक है ना, तो God will also help you only if you are helping yourself. तो प्लीज डोंट बी एंशियस एंड ट्राई टू डू योर बेस्ट, है ना, उसकी जगह ये सोचो कि हम क्या कर सकते हैं in order to improve that condition, and I think that will definitely relieve your anxiety. उसके अलावा if you feel anxious, then you can share your feelings on direct message with me on Telegram or on the Insta Messenger, and I will try my best to motivate you and counsel you. Please take sessions for discussion in future on the YouTube also. Ha, right. So I hope you enjoyed the session and I have answered the queries. You know, sometime I'm not able to answer the individual query. So by this platform, I have tried to answer the queries of the people about the 20th notebook, about the anxiety, and also about the instant PYQs. And very soon we will be completing the instant PYQs. Uske baad we will be starting with the NEET PG PYQs and the FMG PYQs. And if I feel that there are certain questions which are coming from the same topic again and again, then we can have a short discussion of that topic also. So take care, guys, and prepare well. Don't be anxious. Uski jagah, do your best, and we will see you again very soon on both the platforms with the lives. So take care, guys. Bye.